turn it back up. Hi, my name's Grace, and today I'm going to tell you a little bit about a syndrome that I've learned a lot about, and it's called Iridocorneal Endothelial Syndrome. And for sake of not saying that every time, we're going to call it ICE. Who here is in the pre-optometry field or medical field? So the majority, or 80% of the people here, are involved in the medical field, especially the pre-optometry field of medicine. So that is, one of the main reasons I wanted to do this presentation for you is because I think it's going to be really important in your field of study and in your practice one day, when you own your own practice or you work in the field. So hopefully you can benefit from this speech today. I want to give you a background on why I did this. My mom in 2008 noticed that her iris and pupil were changing shape, and she was concerned with that. So she saw her local optometrist. Her local optometrist told her that it was something common and not something to worry about since it wasn't changing her vision or sight. So we didn't worry about it, and 2 years later it progressed, got to the point where it bothered her that there was such a change. So we decided to get a second opinion. We went to another optometrist, and this optometrist told us that there was inevitably something wrong with either her iris or with the pupil of her eye. So knowing that, 3 days later, she and I were on our way to see a specialist. We saw an ophthalmologist who told us, it wasn't cancer, it wasn't a tumor pressing on her iris. Instead, it was something called Iridocorneal Endothelial Syndrome, or ICE. So she was, relieved that it wasn't a cancerous tumor in her eye, and we decided that we needed to know more about this and what was going on. So I got a lot of my information from that appointment. The ophthalmologist was great, knowing that I was a pre-optometry student and had lots of questions. So I got a lot of my information about this syndrome from the ophthalmologist. And now that you know my background and my history with this syndrome, I want to give you the medical terms and the medical terminology and relay to you what I think is important so that someday in your practice or in your field you can recognize this before it comes to a point where someone's concerned about their health that they have to see a specialist. Hopefully you can do something about it before they spend a ton of money to see a specialist. So the first signs of this syndrome, it's a very, very slow progressing syndrome. Like I said, my mom saw this change in her eye over 3 years. So the first sign is the oblong shape of the pupil. And this is what we first noticed. Later, since there's nothing you can do about the change, it turns into a more very pronounced, almost like a melting away of the iris. So that's kind of how the change goes from early on symptoms and signs to the signs later on that you definitely have this syndrome. I also wanted to show that it's not just around the pupil, it happens anywhere along the iris of the eye. You can see this melting away of the iris. This is from the Nova Institute, and I printed this off from one of their Websters, and it's on, I'll tell you the name of the, Emmett Carpel, if you want to look it up, at the Nova Institute. And it demonstrates how the iris changes it and what changes. Anyway, so what happens first is, I'll pass this around so you can look at it while I talk about what it is. So what happens first in the process is a growth on the iris from the corneal surface into the anterior chamber. And this can happen anywhere around the iris, but wherever it starts, wherever the growth starts, it pulls 180 degrees on the other side of the iris. So as the growth pulls one side of the iris, the other side experiences the melting that we see. That's what the hole or the black space that we see, or the change in the eye, is what we notice and what we think is wrong. There is actually more than just that. There's also nodules in the endothelium of the cornea, but those aren't noticeable to the naked eye. It's something that needs to be seen under special equipment. So those are the signs, and then after this goes on prolonged for a long enough time, you start to see intense symptoms of glaucoma, iris atrophy, corneal endothelial, a decrease in the corneal endothelial, and a decrease in the anterior adhesion of the iris. So once the pulling occurs, the iris starts to deteriorate from the lens. There's a few ways you can treat ice, but nothing is going to change the progression. This is something that they haven't found a cure for. So once it typically starts at this, this phase, it's going to take over. It's usually in one eye, and this is what is going to end up happening over 4, 5, 6 years. So there's nothing they can do to really treat it except for contain what level you're at by either eye drops or treating the glaucoma that persists upon having this happen. And I think it's really important that we all know what glaucoma is, how to treat that. So I'm going to go into a little bit about that. In case you see this, you can treat it right away, checking their glaucoma pressures. The glaucoma really is just a intraocular pressure that's too high. Intraocular pressure that's too high ranges above 20 milligrams per mercury. So anything between 10 and 20 milligrams of mercury, or TORS, which is pressure, is normal. You get someone you use your tonometer and you recognize that it's 22 millimeters of mercury, that's too high. They could be they could have glaucoma as a result of ICE syndrome. So I really wanted to show this just for a second because it's interesting how they can treat this without drops. It's called penetrating keratoplasty, and it's a complete removal or transplant of all layers of the cornea. And it's intense, but it's a great learning tool. So if you just want to watch this for a second. So here what they're doing is it's a complete removal of all endothelial layers. So what they're doing here is physically removing all the layers of the endothelium of the cornea. So now it's removed, keeping the eye moist. And then it's a replacement, so they're doing a replaced corneal transplant. And what they do from here is they sew it up and make sure that that the epithelial layers will complete mitosis and regenerate from there. But that's what happens, and that's how you can treat the glaucoma, which is from the ICE syndrome. So really, there's no way but dealing with it, living with it. My mom now, her pupil is oblong, and she deals with it. Every once in a while, we poke fun at her. But really, it's nothing that's going to change your vision or sight unless you let the glaucoma, go for too long without taking care of that. But that's treatable. So I hope that none of you have to see this in your office, but most likely it's something we'll all see one day in our field of study. And hopefully you can treat them and know what's going on instead of, someone like my mom who was turned away thinking she was fine. So any questions? No questions? Okay. Thanks for listening.